Here we have a physio rehabilitation program for 2 different athletes. So this is the ruptured Achilles athlete. So this athlete has been injured whilst playing football. He had a tackle in the cold weather after not fully warming up. The opponent's studs went into the calf, causing a rupture to occur. So this is a elite football player. So they are an important athlete who plays in the position of a goalkeeper. They have been given a rough time of 4 to 6 months for recovery in order to heal this ruptured Achilles. So shown below, you can see what would happen over the next few weeks on the different stages of the injury, the phases it's going through, the goals to achieve within that time, and the training focuses. So I'm just going to go through and explain these. So within the first stage, which is up to about 2 weeks, is the acute stage. So this is phase 1, where the goal is to really reduce pain, inflammation, and to start this healing process. So the training focus will not be trying to repair or remodel, it will be to get this inflammation down. So it's just rest until pain and swelling has disappeared. So to know we've done this, we're having a review after each of the phases. So the review for this is checking that there is nowhere near as much pain and the swelling has definitely gone down. And once this review is okay, we can then move on to the next stage. So, phase 2. This is introducing proprioception. So, light static stretches will be one of the training focuses. So, this is improving the range of movement. And once this is done, and we can see there is a increased range of movement, this review will be ticked off. The second part of phase 2 is adding dynamic and ballistic stretches. Increasing balance and stability. So this will allow the athlete to be able to re-stand on this leg and not have any pain, having strength and being able to stay balanced on that leg as well. So going into phase 3, we've got strengthening exercises. These are body weight and weight exercises. So we start off, we're going to have introducing body weight, so doing body weight squats. And to review this, we're going to do, to see as long as they can reach 50 body weight squats. So weight training and resistance training will then be included after this review has been able to be completed. So this will be using other equipment to be able to see if the stability and the power is coming back and the strength is coming back to the specific area. Eccentric loading will also be used, so doing exercises to a fuller level, really working the muscles to be able to build this strength back up. After this, we're going to move to sport-specific training. So this is looking at about 16 weeks, end of 16 weeks, 17 weeks, so halfway through month 4. Look at skill specific, just to try and get this athlete back to being this elite goalkeeper. So this will be introducing lateral movements. This can be reviewed by doing the Illinois agility test to see whether they can complete it in a quick enough time. And then moving on to introducing speed exercises and drills, changing direction, and these are really specific to goalkeeping. The last training focus will be replicating sport-specific training. So this will be really focusing on the goalkeeping aspects. And once these are all reviewed, we know that it will be okay to get back to training. So here in this graph, you can see the stages of healing, how this, in line with here, we've got the inflammation. So once the inflammation's gone down after about 2 weeks, between 2 and 4 weeks, we'll be able to move on, along with the repair stage, and then inflammation, remodeling comes in. So down here we have the treatment plan of the kind of treatments we're going to include and when they are specifically needed. So on a scale of 0 to 5, 0 being they are not required at that time, and 5 being they will be required, and that is the most prioritised treatment for that time. So going down here, so this is week 1, we're going to be trying to use the cryotherapy and thermotherapy, cryotherapy being the most important at that stage to be able to really get this inflammation down. Taping will also be used to be able to maintain stability around that joint. As you can see, as we move forward for the first few weeks, it's going to stay the same. And then we're going to start introducing other treatments. And then, as you can see in the middle, we are really having priorities of them all. They're all specifically needed. And along here, you can see how the soft tissue is then required in line with this strengthening exercises and sport specific. So here on this graph, this kind of represents this in an easy visual way. So the different colours representing the lines, you've got how important each one of these treatments is at that time. So as you can see here, as this blue line of the IASTM increases, so does some of the other treatments, such as the soft tissue, but these go up in different stages. You can see here that taping decreases and decreases again and again. And then just before going back and doing the sport specific, it is going to increase again because it is going to be important to be taped just in case and to prevent injury the second time. So a treatment overview. So the inflammation, this is going to use taping to support the injury, increase blood flow, using cryotherapy as well to increase blood flow and hopefully reduce the swelling and increase range of movement. Electrotherapy may also be used depending on how bad this is for the patient in order to reduce pain. The repair stage will then use thermo and cryotherapy still, because this is increasing blood flow and help reduce swelling. Soft tissue treatments will start to be introduced to help relieve tendon strain and allow the muscles surrounding to relax. Throughout this, then we're going through to the remodelling stage. This is where the soft tissue treatment is going to be continued to relax the muscles and tendons, including IASTM, in order to help increase range of movement and pain and remove pain when movement occurs. So, some goals that we're going to go through in order for this patient to really have this motivation to carry on. So, when having an injury like this from an elite level, it is really demotivating because you don't know whether you're going to be able to get back to the level you were at. So to have these psychological factors in place is really important. To be able to work towards a goal will really help to motivate. So, for a short-term goal, it is important for inflammation and soreness to be lessened. So this is the goal. That is what you want to achieve in that time. So in order to do this, we're going to have rested the injury and be able to start rehabilitation. So that is the short-term goal of inflammation. So then we're going to move on. In this second stage, the medium-term goal is to have range of movement and stability back to prior ability in order to be able to keep moving on with the rehabilitation program. So each step has to be completed in order to be able to advance. So to do this, the short-term goals will be to improve range of movement and to have some form of stability. And secondly, to have stability back in the injured area to be able to advance to the next stage. So once these are completed, we can then move on. So the next phase, for phase 3, the medium-term goal is to be able to include body weight and free weights in order to increase strength back in the injured areas. In order to do this, it's broken down into 3 short-term goals. To be able to use the athlete's own body weight and carry out exercises. This will then make sure we have stability and starting to build on strength. Secondly, to be able to start to train the surrounding muscles on daily occasions. And then thirdly, to be able to eccentrically squat 2 to 3 of prior ability before this injury. So then moving on from these, we're getting back to skill specific. So this is to be able to goal keep and increase technique from how it was prior to the injury. So short term, to be able to complete the lateral movements such as the Illinois agility test. So this really allows you to realise how over the time you are improving and regaining strength. So by doing this, it can be done over the next 2-3 weeks, and we can really see the difference. The second short-term goal is to be able to regain strength in order to carry out plyometric jumps. So this fits in with the goal of what we want to do and the target of where we want it to be. So this is, by having this goal, it really motivates. And thirdly, the last short-term goal is to be able to use power through the legs to reach and save at least 7 out of 10 shots. So this is skill specific back to the goal setting for a goalkeeper. So all of these short-term and medium-term goals are all leading up to the long-term goal from when you're injured to when you want to be back. So it is to increase strength in order to get back to playing top league games and being able to reach full potential, playing to a level same as prior to injury and be able to be selected for club's first team starting squad. So that is where they really want to get back to. So we're just going to look at some of the exercises we're going to do and able to get to these goal setting. So for phase 1, we are going to leave, as this is going to allow to reduce the swelling. The last thing we want to do is to work too hard too early and cause more damage to the injury. So for a ruptured Achilles, phase 2 rehab exercises include things such as resistance bands and really starting to just increase range of movement. So these are all shown in some of these demonstrations. We've got using resistance bands to move side to side, pushing against a wall, and also just as you can see just here, how slightly different exercises like heel raises and things like this can all work together to increase the ability and strength and mobility around the joint. So phase 2. So during phase 2, we're going to do exercises shown in these 2 pictures. So moving the ankle, this is the aimed exercise, so having a resistance band and flexing and extending the ankle joint. However, if this exercise is too easy, we're going to move on with the different resistance colours. So as you can see here, there is a range of different colours. These make the exercise harder and the resistance stronger. So to start with, we would use higher resistance. If this is still too easy, we can also do one where you raise the leg, and this makes the stability have to work harder. Alternatively, to regress this exercise, if it's too difficult, you can move back to having the lower coloured resistance bands, such as the yellow and the beige. Another type of exercise you can do in phase 2 is the foam rollers. So in order to progress and regress these, we're going to use harder rollers. So this ones such as the spiky ones, these really work into the deep tissue. And then this is the aimed goal. So to be able to roll out the surrounding muscles such as the calf muscles, using your leg on top. So this is putting added pressure onto the muscle you are rolling. To regress this, however, if you cannot do this, just to use the one leg and roll along, this is still going to be beneficial to you. As you can see in this picture, there are different types of rollers. So this one, just the plain one, will be one of the easier ones compared to these that are very painful. However, using some of these different ones to progress or regress will make the injury be able to recover to the level that is possible for the client at the present time. We then move on to phase 3. So this is exercises that will be able to start to use body weight. So as you can see here, 2-leg toe raises, starting to use just one foot, maybe the injured foot, and start to work around that area. So here are some of the phase 3 progression and regression exercises. So the aim is to be able to stand on a bench and be able to raise and lower yourself However, if this is not possible, you can use support. So shown on the right hand side, by using support, you are not putting as much pressure on the injured area.